morning, Mrs. Jones. My name is Carolyn. I'll be your nurse today. Yes, I'm back. I'm going to pull this curtain for privacy, and it looks like you're already in supine position, so that's good. Even though we've worked together before, I still need to check your ID band and confirm your full name and your birthday. So it says your name is Jessica Jones, and you were born July 10th, 1950. Still the same? Good. Do you have any allergies that you're aware of? No allergies? And are you currently experiencing any pain? You're having some pressure in your bladder. Okay, so that's actually why I'm here. The doctor ordered a Foley catheter to be inserted for your urinary retention. Have you ever had that done before? You haven't? No problem. I'll explain it to you, and if you have any questions or concerns, we can address those before we get started, okay? First, I'm going to clean my table with my Sani wipes for 30 seconds and let it dry for 2 minutes. So Mrs. Jones, the procedure for inserting a Foley catheter is first I'm going to clean the genital area to prep it. Then I will put on sterile gloves and insert a soft sterile tube into your urethra, which will then go into your bladder and drain the urine. That should help relieve some of the discomfort that you're feeling. Then I'll inflate a small balloon, which will hold it in place when you're moving around or walking. It'll keep the catheter from falling out. We'll keep it in for a couple of days, and then after we'll remove it and do a voiding trial to see if you're able to void on your own or urinate on your own again. And you might feel some discomfort when I'm inserting the catheter, but you shouldn't be in extreme pain during or after the procedure. So if you are, please let me know. Do you have any questions or concerns for me? How long does it take and where are we going to do it? Well, we can do it right here in your bed. I can do it now and it'll take maybe 10 or 15 minutes. How does that sound? Good? Okay, I'm just going to set up my supplies. I have my stat lock and my CHG wipes and my syringe for the sample. I'm going to put a warm blanket on your upper body because I need to move your blankets and your gown on your legs so that I can prep the area. Okay. Miss Jones, the last time you were here, you told me that your children were having an anniversary party for you? Yeah, they did? Okay. I'm going to help assist your legs into a butterfly position. There was 100 people at the party. Wow, and a live band. That sounds like fun. Next, I'm going to pull up your gown and place a chucks and then clean the area, okay? What kind of food did they have? They barbecued? Burgers and hot dogs. That sounds good. I apologize, these wipes might be a little bit cold. Well, I'm glad you got to enjoy that party. I'm sorry you're back here with us again. I'm going to cover you up. Or the proper receptacle. This is a sterile drape I'm going to place to help keep the area clean. Get my supplies. CHG wipe. And my stat block. I'm going to put on my sterile gloves. I'm just going to set up my supplies. Place this between your legs. So now I'm going to clean the area one more time before I insert the tube. Okay, when I insert the tube, I'm going to have you take a deep breath, and on the count of 3, I'm going to have you blow out, okay? So go ahead and take a deep breath, and then 1, 2, 3, blow out. I see urine returning, so I'm going to go 1 to 2 inches farther. Now I'm going to inflate the balloon. You shouldn't feel any pain. Do you feel anything? No? Okay. Good. I'm going to pull back. I feel resistance, so I'm going to stop. And then we're going to collect the urine sample using the CHG. We're going to scrub for 5 seconds. And let it dry for 5 seconds. You have to collect at least 5 cc's, but it looks like you have a lot more than that coming out. How did that go? It wasn't too bad. A little discomfort, but you're not in any pain now, right? Okay, good. Now I'm going to I'm going to put on the stat lock, which is going to attach the catheter to your leg, and it will help keep it from pulling when you're moving around, okay? So first I'm going to just prep the interior thigh. Put it inside here. So the stat lock should be on the entire time. If for some reason it falls off, please let us know so that I can put a new one, okay? I'm going to take off the sticky part and make sure it adheres to your leg really well. Okay, now that it's adhered to your leg, I'm going to hang the bag on your bed. I'm going to make sure it's below your bladder, but that it's not touching the floor and that there's no kinks or dependent loops, okay? The urine's flowing well. I see about 400 cc's of clear yellow urine. I'm going to finish collecting the urine sample. I'm going to put a patient label with the time, the date, your number, everything on it, and then we'll send that to the lab. I'm gonna just clean up my supplies here. Throw everything in the trash that goes in the trash. And get your legs in a comfortable position. And cover you up. How are you doing, Mrs. Jones? Okay, good. I'm going to document everything. The size of the catheter was 16 French. The urine was clear and yellow. There was 400 mLs of output. I'm going to document the time and the date and that you tolerated the procedure well. I'm going to give you your call light. Make sure the side rails are up. Would you like your head up as well? Okay, we'll put your head up. I'll make sure your belongings are within reach. And I will be here until 7 p.m. If you have any questions, just call, okay? Thank you, Mrs. Jones.